Hello everyone and welcome back to the channel. Today, we're talking about an issue that could reshape the future of the NHS, the lives of tens of thousands of migrant nurses and healthcare across the UK. It's a story that's developing fast, and it's one that deserves our full attention. New research from the Royal College of Nursing shows that up to 50,000 migrant nursing staff could leave the UK if the government moves forward with its plan to extend the qualifying period for indefinite leave to remain, or ILR, from 5 years to 10. That number is staggering, and if it becomes reality, the consequences for the NHS could be catastrophic. So today we're breaking this down in detail. What exactly is changing? Why are nurses so affected? What does the research show? And what might this mean not only for migrant staff, but for every patient in the UK? Let's start at the beginning. The Home Secretary is preparing to release full details of sweeping immigration changes, and one of the most controversial proposals is to double the amount of time migrant workers, including nurses, must live and work in the UK before they can apply for ILR. ILR is essentially a path to stability. It allows individuals to live, work, and access benefits without the uncertainty and restrictions of repeated visa renewals. Right now, the qualifying period is 5 years. But under the new proposal, that would stretch to 10. The thousands of nurses who have spent years building lives here, supporting communities, and working in understaffed wards, this change feels like the goalpost is being moved halfway through the match. To understand why this matters, we need to look at what life is like for a migrant nurse without ILR. Without settled status, most migrant nurses are tied to their employer through a sponsored work visa. If that employer is supportive, organised and fair, it might not be an issue. But if the nurse faces exploitation, bullying, unsafe workloads, or wants to seek career progression elsewhere, leaving becomes almost impossible without starting the visa process over again. This system has contributed to well-documented exploitation in the social care sector, where some migrant workers have reported poor conditions but felt trapped because of their visa status. On top of that, migrant nurses without ILR have what's called no recourse to public funds. That means they pay taxes like everyone else, but they cannot access certain types of state support. No child benefit, no disability support payments, no financial safety net. So if a migrant nurse faces a crisis, whether a sudden illness, job issue, or family emergency, they often have very limited support available. The RCN says this increases the risk of financial hardship compared to their UK-trained colleagues. The Royal College of Nursing is strongly opposing these proposals. They argue that the changes will deepen the existing nursing shortage, threaten the NHS workforce, worsen patient care, and jeopardise the government's attempts to reform the health service. And they describe the policy as a betrayal of the very people who answered the call when the UK needed them most. Think back to 2020. During the darkest days of the COVID-19 pandemic, thousands of internationally educated nurses moved to the UK. They left their families behind, they worked in overstretched hospitals, and they put their own health at risk during those early months when protective equipment was scarce and uncertainty was high. Many of these nurses have been waiting for their 5th year in the UK, preparing to apply for ILR milestone that symbolises stability and recognition. Now, just as they reach that point, the government is saying they'll need to wait twice as long. And this isn't just about emotions or promises. The new RCN research paints a very clear picture of what these changes could mean. They surveyed more than 5,000 migrant nursing staff. Among those who do not yet have ILR, 60% said that increasing the qualifying period to 10 years would make them very likely to leave the UK. Not maybe, not possibly very likely. When you map that percentage onto the actual number of migrant nurses working in the UK right now, you get an astonishing figure. Around 46,000 nurses could choose to leave the country. This isn't just a staffing issue. This would be one of the largest losses of healthcare staff the NHS has ever experienced. And it gets worse. The research found that 53% of respondents are extremely concerned about their financial security under the new rules. More than half, 52%, are extremely worried about the impact on their family life, and 49% are extremely concerned about what this means for their career development. These are deep, severe levels of distress. But here's an even more alarming finding. Only 11% of the nurses surveyed said they would have moved to the UK if the route to settlement had been 10 years from the start. In other words, this policy doesn't just push current nurses away, it may also dramatically reduce future recruitment. And this is happening at the same time that domestic nursing student numbers are falling. Since 2021, accepted nursing applications are down more than 22%. The UK already does not have enough homegrown nurses, and these changes could make the situation almost impossible. The personal testimonies from nurses in the report are powerful and emotional. They put human voices behind the statistics. One nurse from Nigeria said, "During COVID, we were needed, and there were loads of incentives to bring us from around the world to help the NHS. We left families and loved ones behind. These proposals reveal a profound ingratitude toward those who stepped up as heroes," a nurse from Egypt shared. This policy has created a wave of disappointment and uncertainty. It has shaken the sense of security we hope to achieve. Many of us are reconsidering our future in the UK. Several colleagues are actively thinking about moving to other countries that offer us stability. And a nurse from the Philippines said, "I have colleagues who have left the UK and are now happily working in the USA or Australia. One colleague cares for her autistic daughter but can't access disability funds because she doesn't have ILR. Increasing the requirement to 10 years means depriving families like hers of essential support." These stories appear again and again across the survey. Many migrant nurses say the proposals make them feel unwelcome. Others say the tone of public debate around immigration has grown more hostile and they feel increasingly targeted by political rhetoric. The RCN has warned that anti-migrant messaging is contributing to a rise in racist incidents, creating a climate of fear for staff who should feel safe and valued in their workplaces. Let's step back and look at the broader picture. The NHS has been struggling with chronic staffing shortages for years. Wards are understaffed, waiting lists are long, and the pressure on the system is immense. Internationally educated nurses have been a backbone of the NHS for decades. They fill gaps that domestic recruitment cannot meet, and they bring essential experience and expertise. But if thousands of these nurses leave, and if thousands more stop coming to the UK, the consequences for patient care would be devastating. More delays, more burnout, more closed beds. More pressure on everyone left behind. RCN General Secretary Professor Nicola Ranger summed up the situation clearly. She said, "These proposals are not just immoral, they would be dangerous for our patients." She pointed out that the government is failing to build the domestic workforce while simultaneously pushing away internationally recruited nurses who keep the NHS functioning. Her message is simple. If the government continues to make migrant nurses feel unwelcome, they shouldn't be surprised when those nurses decide to go elsewhere. Let me know your thoughts in the comments below. If you found this video informative, please remember to like, subscribe, and share. It really helps the channel and helps more people learn about important issues like this.